Okay, recording in progress. Welcome, everybody. I'm Randy Height, Director of the Nancy Marks Cancer Wellness Center over at the Sid Jacobson JCC. Just as a brief overview, we offer all kinds of holistic services to cancer survivors in any stage of their diagnosis. Anything from exercise classes, discussion groups, short-term individual counseling sessions, an annual retreat, educational programs such as this, and many other information programming that we can provide for you. If we don't have the information that you're looking for, please feel free to reach out to us. We're happy to do the research and find what it is that you are looking for. So what I'd like to do is introduce our presenters, because I don't want to take up too much time from their speaking. I'd like to first introduce Dr. Graceann Forrester. She's an NYU physical therapy graduate with 30 years of experience. She's seeing patients as part of oncological rehab program, which was directed by Dr. Sokoloff. Is that correct?
Yes, correct.
This is what I have.
No, today was his last day. That's okay. Yep.
Oh, today was his last. Okay.
So maybe we're covered that way. Yeah.
Okay. So Graceann comes to Rusk from Memorial Sloan Kettering, where she specialized in creating customized protocols for oncology lymphedema patients based on her Norton, DeLuke, kinesiotaping, and cancer exercise specialist certifications. She applies her extensive background in manual therapy to provide relief from the functional limitations of lymphedema for upper and lower extremity patients, those suffering from breast and pelvic swelling, and the complications of neural tethering, cording, and scar tissue restrictions. As a clinician, international educator, and certified lymphedema therapist, she brings a breadth of understanding to all things physical therapy. As a transplant from the Finger Lakes region of New York, she is the mom of 4 and newly minted grandmother of 1. You do not look like a grandmother. Wow, congratulations.
Thank you. Thank you.
Thank you for joining us tonight, Dr. Forrester.
Okay. Should I try to share my screen, Randy?
Please go ahead.
Okay, here we go. Finding that screen and make it into a PowerPoint. All right, there we go. All right, so my task tonight is to look over and review different kinds of side effects from surgery and all different kinds of treatments for breast cancer. Let's see if I can. Here we go. All right. So when it comes to rehabilitation in cancer care, what does that mean? It means any function or rehabilitation intervention for any cancer patient at any point along the continuum with a goal of increasing personal ability. So if nothing else comes across in this seminar other than it doesn't matter where you are in that cancer journey, if you're just starting or if you're in the thick of it, if you have been a survivor for 5 or 10 years longer, if there's been a resurgence of that cancer and we're in the midst of fighting it again, anywhere on the continuum, you can ask for help for so many different side effects. So specifically before and after surgery, during radiation, before and after radiation, before and after chemotherapy, again, anywhere along that line. In 2020, an estimated 279,100 people were diagnosed with breast cancer. And at that moment, we're looking at a 5-year survival rate of 90%. With that in mind, as clinicians, we are looking to help you not just survive, but thrive in that time after cancer has been diagnosed. And so we're looking for healthy ways to move and to breathe, healthy ways to work, healthy ways to help you take care of your families. But we want to just not make that all about survival, but about thriving. On an online survey, 2010, at the Livestrong University, 2,307 cancer survivors were surveyed, and they asked, what kind of things are you limited in? Are they physical, emotional, or practical? Most of them were within that 1 to 5 window of their cancer treatment. Between the ages of 20 to 54, 86% had at least one impairment. So in other words, one physical thing, one emotional thing, or a practical limitation like, I don't know how to, I need help driving. I need help navigating, hallways. I've got a little bit of brain fog. So it's not unusual. It's not unusual. From that same survey, 91% had one physical concern. 75% of those that had a physical concern got help. 96% had one emotional concern. 55% of those received help. 76% had a practical concern, and only 40% of those received help. Those of us on the rehab side of things, we would like to close that gap. We want to make sure that you're getting care, even if it is only one thing. It's not just only one thing. We're talking about trying to make you as effective and energetic within your life, not making exceptions for all of that. Now, even within that study, the most frequently answered or ticked off physical concerns were low energy, difficulty with concentration, sexual dysfunction, neuropathy. Most respondents said that they had not received care for those particular items.
I interrupt you for 1 second?
Please,
I'm sorry, but the slides are not coming up on the screen.
Oh,
they're not changing.
Let's see. It says I am sharing my screen.
Yeah, but the actual slides are not changing.
Slides are not changing.
No.
Okay. So are we stuck on the first one?
Yes.
We are stuck on that one. Let's see. If I do that, if I click in there, does that change it?
No.
No. Okay. Let's see. More slideshow options.
Sorry, everybody. I did want you all to be able to see everything, and I didn't want to interrupt your flow.
No, that's okay.
Oh,
there we go.
we have
Much
movement.
better.
Do we have movement?
Yes, we do.
Yes. Can you see slides now?
Yes.
Yeah. Okay. So most of that was numbers. So let's get to, I was just leading up to this one. Can you see the slide with the graph on it?
Yes.
Yay. Okay. All right. So leading up to this slide, which perhaps has the most pivotal information in, is that if you look along the bottom of the slide, this is from that same 2010 survey, energy, concentration, sexual functioning, neuropathy, pain, incontinence, lymphedema, oral health, lungs, vision, thyroid, feeding, hearing, and heart. There's a tremendous number of people that are not getting care for their symptoms, and breaks my heart. And we need to work really hard as clinicians to try and get more information out there. All right. Did it change? Are we on possible side effects of oncology treatment surgery? Yes. Okay, good. All right. So surgery under any conditions can be have large side effects. It can be devastating. It can be life-changing. In the oncology field, we're looking at loss of mobility due to tissue removal. So they are going to go in there and going to take care of that, remove that cancer, those cancer cells, and there may be other tissue that needs to go with that. That can be in the shoulders, the chest. It can affect the ribs, even your breathing, because of that new container, that smaller container that you're working in, which is the skin and all that tissue. Surgical scar restrictions. The scar itself can be a restriction. It may be very fibrous. It may be stuck to a lot of other tissues. You may find that when you go to raise an arm, when you go to take a deep breath, you feel a catch. And that can even be from the surgical scar all on its own. If someone's had breast tissue removed and then a temporary implant placement, those things need filling to stretch the tissue before a permanent implant goes in. That stretching is felt all the way around the chest and into the shoulders. And so we can have side effects of limited movement from that and pain. There can be post-surgical swelling. Now, when I talk about post-surgical swelling, I mean specifically from the surgery itself. We'll get to the point of talking about a little bit more lymphedema, but you can have swelling from that chest surgery or breast surgery. If lymph nodes have been removed, it may result in lymphedema or swelling from that limitation in that system. And that can be anywhere, neck, chest, arms and hands. We just say the upper quarter. You know, all of that tissue can start to swell because the system, the current of fluid exchange has been disrupted. Chemotherapy can be administered in so many different ways now. We've got some great recipes, if you will, for chemotherapy. There's systemic chemotherapy, which means it looks for cells throughout your entire system, your entire body. It searches out for those cancer cells. And it may have some side effects because it's looking for cancer cells, things that rapidly reproduce. And much of our system, like our blood supply and our GI tract, those have rapidly reproducing cells. So sometimes that systemic cancer therapy can start to make some side effects in those tissues as well. Targeted chemotherapy, these are some agents that seek out specific cancer cells or specific support for those cancer cells. So that looks for those tangled vascular systems or how the body can feed the cancer, and it may target those systems. Immunosuppressive drugs, ones that are really tied into our immune system. There are drugs that can go in and find those cancer cells that are hiding. Depending upon the recipe, if you will, is going to be based on the type of cancer, the stage of cancer. And so you may get a combination, which means that the side effects can be a combination of things depending upon how the chemotherapy is delivered, when it's calendared, how they might be paired, or how they might be given separately. So there's a definitive advantage to combining the drugs to fight the cancer, but it also means that there may be some very definitive side effects. Those side effects can be something called CIPN, chemotherapy-induced peripheral neuropathy. That so chemotherapy prompted, or because of the chemotherapy, peripheral, meaning out in the hands and feet, in the periphery. If you think of peripheral vision, it's to the sides, it's way out from your center. And neuropathy, it affects the nerves. So then you may have difficulty feeling things with your fingers, maybe difficulty being able to button your shirt, or managing your keys or coins. It can translate into the feet as well. So you may have balance disturbances. Either way, hands and feet can change the sensation. There can be numbness, tingling, and even pain. For those side effects, it may also increase the risk of falls because you just don't feel what you're stepping on, or you go to reach for something and lose sight of that because you're not feeling it. So high risk of falls in that department of CIPN. There can be swelling from lymphatic system fatigue. The chemotherapy is searching out those cells, and the lymphatic system is your garbage collection system. So your lymphatic system is collecting all those cells that the chemo has killed. And that's a taxing effort. So you can get swelling. It can be general, even in the abdomen, even with breast cancer, it could be in the abdomen, it can be overall. But that's something that definitely is something that rehab can help you with. There are cardiotoxic symptoms. In other words, the heart can be compromised by some of these chemotherapies, and your oncologists are going to do a great job monitoring that. You may even have to have some ultrasound of your heart to make sure that it's remaining healthy. And one of the biggies with chemotherapy is always fatigue. You're fighting that cancer, and the chemotherapy, and that can cause fatigue. But the chemotherapy in your body can cause you fatigue. So don't put that to the wayside. That's generally something that we should talk about, and we should look at seeing what we can do to change that fatigue level for you. The immunotherapy are what are called checkpoint inhibitors. These are proteins and immune cells that are activated to give you an immune response. So to fight off that bacteria, that flu symptom, that even for that matter, poison ivy, your body sends out histamines, immune responses to try and keep that under control and keep it limited. Cancer cells hide in those checkpoints to avoid being attacked. But immunotherapy kind of uncovers those checkpoints and helps the body target those cancer cells. Side effects from immunotherapy are laundry list long. Fatigue, that can be from low blood sugar, low blood pressure, joint pain, muscle pain. You may find that you have energy to fold 3 shirts, but not the whole load, because that muscle fatigue can kind of creep in there. You can have GI upset, diarrhea, dehydration, weakness, especially if you're having difficulty taking in foods, shortness of breath, swelling anywhere, and skin irritations. Some folks have to go through radiation therapy, and that's a whole kind of seminar on its own about all the different kinds of radiation. But the side effects are just as real. Local swelling and skin irritation. The skin can change color. It can become very fragile, very thin and fibrous. It can blister, have open wounds. It's a tough haul with that radiation. You can have that in the upper quadrant. In other words, neck, shoulders, chest, ribs, arms, and those upper quadrants can start to swell. There's changes to the tissues. What was once soft and supple can become fibrotic and kind of rigid and leathery. That can change how the lymph nodes work and how the fluid flows between tissues. We call it myofascial fibrosis. Any tissue through which radiation has passed can become fibrous, and then you end up limiting the motion of that at the skin level and even deeper. And we can't stress enough that radiation also can cause fatigue. On that note, cancer-related fatigue, CRF. The incidence of cancer patients experiencing this level of fatigue is about 90%. All of the research suggests that 9 out of 10 cancer patients have this kind of fatigue at some point in that cancer journey. And when does it occur? It's usually during or right after the cancer treatment. And how fatigued do you have to be in this classification? You are tired doing normal things. Normal things. Getting up, getting dressed, or showering and getting dressed, you may need to rest. Prepping your lunch, eating lunch, you then may have to rest. So this is not the kind of fatigue after going out and running a mile or running 10 miles. This is with normal activities. And generally, when we say, how about you take a nap, doesn't really make things a whole lot better. It still kind of comes after you during the next normal activity. The risk factors that increase its incidence are if you're already in pain, there's some depression and anxiety, untreated, inactivity, not sleeping well, not eating well, and lots of medications can increase your risk. And so some of the things that we'll work on, I know that Bonnie's going to talk about exercise. For as tired as you may be, exercise is one of the best things, but in controlled doses. So we're not going to ask you to go out and walk for 45 minutes. We're going to do small things and slowly build up your tolerance for the bigger things, the more important things. So how do you come to find care? And how do you know what care you even need? Self-advocacy. Make a list of those questions. If you have questions, they were meant to be asked. Ask in the very beginning, you might ask, what are the names of the treatments that I'll be receiving? Adriamycin, Cytoxan, Taxol, Herceptin. It all sounds a little Greek at first. It all sounds like alphabet soup. But see if you can get some of that information from your oncologists. And at the very least, ask, what side effects should I be watching for? Now, the oncologist is going to be watching, but from the inside out, you're going to know that things change. And so asking or saying, I'm having nosebleeds, I'm really tired, I'm not sleeping, I'm having trouble keeping food down, making sure that you're communicating that to make sure they hear you. It can be a bothersome kind of side effect. It can be like bothersome, like my sleeves on the left don't fit the same as the sleeve on the right. Is it painful? Horrible? No, but that could be a sign of something else. So keeping them abreast of painful things. If you're unable to continue to take care of yourself or your family, and if it drains your energy, for the good stuff. In other words, I'm okay getting up and getting dressed and getting my family what they need for the day, or even getting to work. But then I'm exhausted and I can't pick up my kids from school, or I'm exhausted and I can't watch the championship game. I can't paint like I used to. I can't do the things that are important to me. Say something. Ask them, what can we do about this? It's not just a check off to them, oh, okay, so you're having nosebleeds. Okay, good to know. No, ask the question, what can we do about this? Can you offer me someone who can help? And fundamentally, there is no limit, no time limit on when you can ask for help or when we can intervene. Please don't think, well, I'm a survivor. I'm 10 years out, but I'm still really tired, or I still have a hard time washing my hair with my right arm because I have shoulder pain. Let's get you in. Let's figure out what kind of things we have lots of time to work on. So what can you expect when you come in for physical therapy? We've got this information gathering time. We're going to find out about your past medical history. You may have swelling in your arm, but I'm going to also ask about whether or not you have a history of diabetes, whether or not have you had any fractures, any broken bones in that arm? Maybe when you were 12, you fell out of a tree. It might be good to know. Maybe something's a little different there that we could look at and investigate. Where are you in that oncology journey? What treatments or surgeries have you had? Where are you in that journey, and what's yet to come? And what are you having trouble with today? Give me the list. Give your physical therapist the list. Self-care, whether or not you can dress yourself and do those buttons, whether or not you can tie your shoes, they keep coming untied, whether or not you have concerns about going up and down stairs. I'm good throughout the day, but when I have to make that trip to the car, from the car to the doctor's office, I have my appointment. When I get back into the car, when I get back home, I am beat. The fatigue is overwhelming. I'm done for the day. If you're still working, what kind of things? I get a lot of neck pain working at the computer. We can work on that. We can do an ergonomic assessment. What pain do you have? What swelling do you have? Where is it? When is it worse? When is it better? From a physical part of the exam, we're going to check your posture. How much can you move? How much can't you move? What's missing? How strong are you? We're going to test out the muscles. Then we're going to look specifically at the treatment area. We're going to look at the scars. We're going to look at the skin changes. We're going to look at swelling. We're going to check your mobility, your balance. Hey, is that sensation in your hands or feet bothersome? Does it change how you do things? Are you at risk for falling? So we'll do some balance testing. We'll do some vestibular testing, and we'll do some endurance testing. No worries. The standards for treadmill test, for cardiac testing, endurance testing start out at a mile per hour, really low, really steady. So you're not going to have to, prep for that exam. Treatment options, individual strength and stretching exercises, balance exercises, cardio training, soft tissue mobilization. We may be able to get into those tight tissues, either at the scar or in the radiation area. Something that's tight and stuck. The analogy I like to use is, those grocery bags, the ones that have, you want to put your vegetables in, but you can never open, you're doing this the whole time. Your fingers are going back and forth and back and forth. And then once you open it, it opens into this bag that you can put your produce in. Well, there are times after treatment that soft tissue gets so tight and stuck, it's really hard for fluid to get through. It's really hard for you to move inside that container. So soft tissue mobilization is an important part of how we treat those limitations. And then we can do a full assessment for lymphedema. I know it's a small picture, but if you can look close, those dots in that drawing represent your lymph nodes. So your lymph nodes are part of the immune system. They complement your circulatory system, so your blood supply. There's large and medium and small vessels that carry garbage, in essence, the waste products of our body, of our body's function, to those lymph nodes. And there they are filtered and broken down into its composite pieces. And then if it's salvageable, it gets put back in the system and we recycle things. If it's garbage, it goes back out into either our respiratory system to breathe out. It can go back into our gut, in our bowel and bladder, and be excreted that way. So if I can call your attention, there's a little line and it says lymphatics of the lower limb. You can see my cursor here. But if we look at one of those dots, we just pick up one of those. If that's a lymph node, the green strings leading to that lymph node are the vessels, are the tracks that carry the fluid to that lymph node, to bring the garbage to that lymph node. Now, if that little lymph node is removed, then those vessels are still there. They just need a new direction. They need a new direction to take that fluid to the next lymph node. So our endeavor is to find out if we can redirect that fluid, where the body will let us send it. There's all different methods. So we can look to, I'm going to bring my cursor up to the armpit up here. We can look to kind of rehab that area if there are lymph nodes left. We can look to redirect some of that fluid up towards the neck. We can redirect that fluid towards the lymph nodes in the rib cage or along the spine, even into the abdomen. There's 600 to 700 lymph nodes in the body. So granted, they could be tired from chemotherapy. We're going to give them a break and we're going to intervene to see if we can't help those lymph nodes function better. And wherever there are, if especially chemo and radiation are finished, we may be able to redirect that fluid to very happy, healthy areas that they're not opposed to taking on a little extra work. So we can get that fluid moving, all right, get it redistributed. Now, lymphedema is a lifelong injury, if you will, to the system. And so what we'll then do is teach you maintenance things to do once that lymphedema is under control. That therapy will include muscle pump exercises that are a bit different than strengthening exercises. We'll look at skin care. We'll look to make sure that the skin stays soft and supple so that it's easier to move. There is something called manual lymphatic drainage, which is actually a massage technique to help guide that fluid, to create that new current, to help the body take that garbage collection to healthy lymph nodes that can actually break that down and remove the waste products and recycle what's good. We may end up In many cases, not all, we may end up looking at a compression wrap, which is bandages and some foam, or a garment. You may have seen compression sleeves or gloves. There are compression bras. There are even things called swell spots. If you just have one smaller area that's swollen, we can treat just that small area. So lots of options with lymphedema therapy. So overall, how can you improve the physical side effects that you have from your cancer treatment? First off, make sure that you're verbal. Explain that these things are troublesome or they're painful. Don't prejudge the doc that's going to say, well, it's just part of the process. No, let them know. Talk with your oncologist, your plastic surgeon, your rheumatologist, your dermatologist. Talk with one of your doctors, even your primary care physician, and explain that you're having symptoms. Ask for a referral or a prescription for physical therapy, or even specific lymphedema therapy. Make an appointment with your local oncological physical therapist. The PT will work with you to develop a plan. They're going to address those side effects, see what they can do to improve or balance out, help manage those side effects. Treatments are usually 2 times a week. They can be more than that if your fatigue can tolerate. Those sessions can run from 30 to 60 minutes. Most of them are covered by insurance. But please remember, anywhere along this continuum, anywhere from day one, you get the diagnosis, you can call and ask for a referral. We can get you in and we can do what's called prehab. We can kind of talk you through what to look for, how to figure out if you're having some side effects, when to talk with the doctor. If you're in the midst of treatment, anywhere in there, you can ask for a prescription and we can help manage that as you go, or even afterwards, immediately afterwards. And again, 5, 7, 10, 15 years later, we can look to manage symptoms. Some things we might be able to fix, others we put in a maintenance program in place. All right. I hope that's offered some guidance, some strategies, and maybe even a bit of confidence that a lot of people, 90%, 9 out of 10 cancer patients have side effects. You may be one of them, and you deserve care to not just survive, but thrive. Thank you.
Thank you very much. That was really informative. And I do know that we have some questions, but if you wouldn't mind, I'd like to give Bonnie an opportunity to share her information, and then we will have a very hopefully robust question and answer period after she goes. So I'm going to do my best to share my screen for Bonnie. Let me see if I can get to it. Okay. That's not what I need to do. Okay. Let me see this. Whiteboard, is this it? No. Okay, that's not it. Shoot. Let me put Roberta in. Let me just try to figure this out. Give me 1 second. Because I did it earlier, so I have to be able to do this. Yeah, is this it? No. No, how come I have so much stuff here?
Is it over, Randy? Did I miss it?
No, you didn't miss it. I'm just trying to figure out how to share my screen, Roberta.
Oh, but it started at 7, right? And it's 7:40.
Well, you did miss some of it. You did. I'm not going to
All
say
right.
you didn't.
But can I hear it? Is it recorded somewhere?
I recorded it, but I have to write. Just give me 1 second. Let me try to figure this out, okay?
Okay.
This would not be it. Damn. I had it before. Shit. Okay, Bonnie, I might have to have you just speak. because
Okay, well, I
don't
have,
know
I have a
if
hard
you
copy
can.
of my PowerPoint, so I guess you won't have the benefit of seeing, but I will give you the information I can, verbally share. So
Right.
I just, for those of you, some of you
Introduce
know,
yourself, because I didn't even get a chance to introduce you.
right,
Sorry.
I was actually starting to say that. So I do know some of you who are on the screen here tonight, but for those of you who don't know me, my name is Bonnie Oringer. I've worked with Randy, as she said in the very beginning, I believe she said, I worked with Randy in the Nancy Marks program for 9 years. Prior to that, I've been working in the fitness industry. I used to say when I did these talks like 20 years, but more like 25 now, maybe, in a lot of different capacities as a personal trainer, as a group fitness instructor, and most recently doing cancer exercise, both in group settings and individually. And I like to call it restorative exercise because and what I'm going to share with you tonight are the very real benefits that exercise can bring to you. Dr. Forrester did a really good presentation just now about there's so many side effects of cancer and cancer treatment, and she enumerated many of them. There are others, but there are certain things that she touched on that can be done to alleviate some of those symptoms, and reaching out for help in all of these arenas is really great advice. But I'm specifically going to identify and talk about some of the things that exercise can do to help with some of these side effects. I'm just going to start out by suggesting that, exercise is something that really all human beings, whether or not they are cancer survivors, should be doing on a regular basis. The American Institute of Cancer Research has their own recommendation for exercise for cancer survivorship. And that recommendation is to be physically active 30 minutes daily. Believe it or not, that recommendation that the American Institute of Cancer Research has is the identical recommendation for all people, whether or not they're cancer survivors. And the National Academy of Sports Medicine and all these other governing agencies would say the same thing. But what the exercise will look like might be a little bit different. Another recommendation of the American Institute of Cancer Research is to be as lean as possible without being underweight. And we'll talk a little bit about the importance of having a really good ratio of muscle mass to body fat. So what are some of the things that exercise can do for you specifically? So one of the very good things that it does for you is helps reduce the levels of circulating estrogen in your body. And as some of the people here tonight probably, I'm not aware of all your different situations, but many of us, including myself, and I think I should have said in the beginning, the one thing I left out is that I am a breast cancer survivor. I was diagnosed in 2012. My breast cancer was estrogen positive. And so for those of you who may be experiencing that, exercise does help reduce levels of circulating estrogen. Many people are on estrogen suppressing medication in the form of tamoxifen or other aromatase inhibitors. And this is just an added boost to those medications. Exercise also can help with toxin reduction. You release toxins through sweat. And so that's one way to release things that are in your body that may not be, good for you. And it's also very, very helpful for mind, for stress reduction, right? The mind-body connection we have. Just, a lot of people, when they exercise, one of the things they say is, I feel better. And you know what? You feel better. Why? Because your body is moving. You might be able to just sort of like go into a zone where you're not thinking about what's going on in your body, or your own cancer situation, or where you are in your journey. You're just kind of like focused on the here and the now of the exercise. And there's that connection between if you feel better, you might look better. If you look better, you might feel better. It's very cyclical. I actually had a slide here kind of with a nice little diagram about the cyclical relationship between mind and body, and you know, how motivating yourself to exercise might be difficult, but if you feel better, you'll feel more motivated, and it's kind of a flow. So there are not only psychological benefits that you feel better, but there are also physiological benefits. And this again goes into that category of, we're not just cancer patients and cancer survivors, we are people, we are human beings. So some of the really main physiological benefits of exercise is improvement of cardiovascular capacity, decreasing blood pressure, decreasing blood sugar levels, decreasing cholesterol levels, all of which are things that, you know, can lead to other problems that you might have, regardless of your cancer situation, whether you're still currently, you know, dealing in, and you're in treatment or not. You still have to worry about these other parts of your physical well-being. We're not just cancer patients, we are people. And I like to keep stressing that because, you know, we get so focused on running to, let's say, you know, get your chemotherapy treatment. And of course you need to do that, and radiation. And of course you need to do that, but you still have to take care of all these other aspects of your health at the same time. So even though you might be very tired, and that's a real problem that with cancer-related fatigue people experience, it's really, really important to continue exercising. And again, I'm going to talk a little bit later as to what that looks like, but to continue exercising even while you're going through treatment. And there've been lots and lots of studies that have shown that cancer-related fatigue, and I think Dr. Forrester touched on it, is one of the biggest complaints. This, you know, it's kind of like a collateral, what do we call collateral damage of all these other things, all the other things that you're experiencing when you're going through chemotherapy and radiation and surgeries. And what can exercise do for you? Well, even though you're feeling tired, and that tired is a really strong tired, it's not like a normal tired. There have been lots and lots of good studies that have shown that people who exercise throughout their treatment do much better with their fatigue levels. So even if it's just going for a stroll 10 minutes a day, 10 minutes a day is okay. Let's work up to 30 minutes a day, but doing it in little increments. You might not be able to walk for 30 minutes, and that's okay, but walk for 10, then maybe take a rest, and then maybe go for another 10-minute walk, little bits at a time, just to kind of, you know, push yourself till you can build up the endurance to get to that 30 minutes a day. One of the other things that, again, going back to that mind-body connection that I was talking about, exercise is a really great way to kind of help you restore control over your own body. A lot of people, myself included, experience this sort of, what I felt was a loss of the ability to make decisions and have control over a lot of the things to do with my day-to-day life, also with how my body was reacting to things. I wasn't in control of a lot of that. And of course you have to defer to your doctors, and you, you know, have to do your treatments, and you have to do all of these things. But when you choose to exercise, and how you exercise, and where you exercise, and who you exercise with, and what type of exercise you do, that's all under your control. And so you can actually do something for yourself that it's all in your own, you know, I don't know, today I want to go for a walk. Tomorrow, maybe I want to swim. Tomorrow, maybe I want to dance in my living room with some music. You know, these are all things that you have choices about. And when it comes to doing other things with regard to your own treatment and well-being, you don't necessarily get to choose. You know, your doctor says, this is what you need to do. This is where you need to do it. This is how many times a week you need to do it. And you don't have that choice. So I always think of it as one of the real important aspects and real important benefits. Another list, and again, this is another slide that I would have, is that exercise helps increase range of motion, can help increase range of motion, flexibility, endurance, and strength. Now, these are 4 components that I usually identify as the components of any good workout or exercise routine, because you really need to be able to be flexible, have good endurance and strength. So what are some of the things you can do to get better at all of these things? Well, first of all, some of the treatments that people are undergoing, including the surgeries and the chemotherapy and the radiation, negatively impact all of those, right? Range of motion, right? If you've had surgery, you might have limitations in your shoulders, you might have tightness in your chest. These are a lot of things that can happen as a result of your treatment. And specific exercises can be designed to help improve all of these things. Things like yoga and yoga-like movement. And that's one of the things that I like to do in my restorative exercise program, is what I call a lot of yoga-like movement. I'm not a yoga instructor. By the way, I'll just mention that for those of you who don't know, the Nancy Marks program has a wonderful yoga instructor who does yoga for cancer survivorship. And so the movements have been tailored very specifically to help address some of the kinds of limitations that surgeries and other treatments, radiation, et cetera, have perhaps caused. Cardiovascular exercise is very important to help improve your endurance. Endurance is how much work can I do, for how long can I do it, right? Resistance training, which is, when I say resistance training, mostly I mean working with some type of weights, is important for a lot of reasons. Being stronger, having more muscle mass, very healthy, very important. And also it's very good for bone density. Women, especially as we age, tend to, the age range really, once you hit your kind of 50s or so, you start to lose, you lose muscle mass, you also lose bone density. And some of the treatments for breast cancer, the aromatase inhibitors specifically, and tamoxifen, can cause additional bone loss. So the resistance training really can help improve that. So it's very, very important to include that, as well as to make you just, stronger, more muscle mass, feel better, etc. And then one of the things I like to always focus on when I'm doing any kind of exercise program is some core exercise. Your core is your body, really from your top of your shoulder to, you can't all see my whole body, but from the tops of your shoulders all the way down. If you take your arms and kind of circle them around your body right below your hips, that front and back of your body, that is your core. It's not just your abdominal muscles. Your core houses a lot of those lymph nodes that Dr. Forrester pointed out on that diagram. And there are a lot of times where when we talk about lymphedema management, kind of like starting at that center, opening up all those lymph nodes in the center of your body with core movement is very, very important. What can exercise also do? It can also help combat weight gain. Again, it's really important. You might remember I said in the beginning, one of the recommendations of I'm losing my train of thought. I don't have my slides right. Of the American Institute on Cancer Research, it'd be helpful to have my slides up there, is to be your lowest possible weight without being underweight, right? We're not talking about being super skinny. That's your lowest possible, I shouldn't say lowest possible weight, your lowest possible healthy weight. So your healthy weight doesn't mean super skinny. That's not what we're talking about, but having as much lean muscle and low body fat ratio. And so unfortunately, one of the undesirable side effects of a lot of the, hormone therapy and just being sort of not as active because you might have undergone surgeries and treatment, being tired, is weight gain. And so exercise, we all know, helps with calorie burn. I'm not going to go into the science of it because I know we're really short on time, but there is a formula basically about how many calories you need to eat, less than the calories you burn to lose weight. Exercise, of course, increases calorie burn, and that's going to help you maintain your body weight. I'm trying to sort of speed through some of these because I want to leave some room at the end for some questions because I know people have them. Exercise can also help with easing joint pain. There's again a wide body of research showing that exercise really limits and reduces the side effects of some of the aromatase inhibitors, again, that cause joint pain, and also the joint pain you might be experiencing just from being tight from some of your surgeries and things like that. Studies through the American Cancer Institute have shown that physical activity is associated with increased life expectancy, which obviously everyone is, interested in, whether or not you're a cancer survivor. And that research also shows that regular exercise boosts the life expectancy, not only of healthy people, but extends the life of cancer survivors. Another side effect of all of our, cancer treatment and the worry that we may experience is sleep disturbance. I think probably Dr. Forrester touched on that as well, that you might be experiencing sleep problems. And again, physical activity, the more physically active you are, exercise will help quite a deal with, you might just simply be more physically tired, therefore more likely to sleep, as well as we talked about, I talked about a little bit, the improvements in your mental state in terms of feeling better. If you feel better and you're not as stressed, you may sleep better at night. And of course, we know that sleep is very restorative. And so sleep is really very, very important. So exercise, again, if you're not exercising, try to add more movement into your day, and that can help with your sleep. Exercise can also help improve metabolism. So again, with that whole thing with the calorie burn, but also improve digestive regularity. And sometimes people, again, your dietary changes, you may have experienced some irregularity with your bowels, and it's shown that exercise can really help increase moving things along. And of course, drinking plenty of water as well to help move things along is very important. And we're just gonna quickly go through. One of the things I'm not going to touch on too much because Dr. Forrester mentioned it, but there is a lot that exercise can do to help with the prevention and management of lymphedema. There are specific exercises, and when I was doing some classes with Nancy Marks, I used to like to touch on them in most of my classes. They're very specific movements. They're not difficult movements. They can be done once or preferably twice a day. You can do them simply sitting in a chair sometimes. You don't need special equipment for them. But these are exercises that basically will help keep that lymphatic fluid moving along, and coupled with, if necessary, other treatments for lymphedema can really help limit swelling and some of the other side effects that you may be experiencing. And I just lastly, and I'm again, because I want to leave and it's at 8 o'clock already, and I know people have questions, but I mentioned it briefly, but what does the 30 minutes of exercise look like for people that, we want you to exercise? And here's what I'm going to say. It should be movement in any form, at least in the beginning. Some of the more formal exercise classes, like the Nancy Marks program offers, those are great because they're 45 minutes. You're going to be moving for that amount of time. You're going to get what you need in terms of, care, in terms of being gentle enough for where you are in your journey. But if you can't join us at those programs and you don't have time to do the program at the time that the program is offered, you still want to be moving during the day. And I just encourage everybody to move, whether it's, like I said before a little bit, whether it's going for 3 10-minute walks during the day, whether it's putting music on in your living room and dancing, whether if you like to play tennis or golf, or you like to swim, or you have a dog and you like to go for walks with your dog, or you want to play with your grandchildren on the floor. And I know that I have a 2-year-old grandson who recently had this little tunnel thing, and I was crawling through it with him. That was a workout. So workouts could be a lot of different things. So I'm just encouraging you to move. And just one more caution when you do it is listen to your body. You should always be aware, no matter where you are, whether it's in a formal class or on your own. If something doesn't feel right to you, you don't want to do it. You don't want to be injured, especially if you're, in treatment and you're dealing with other medical issues. But listen to your body and do it at the rate and the way that you can, so that you don't get hurt, because the 2 steps back, you don't want to take them. So I know it was a little bit jumbled at the end there, but I just wanted to get some of this information out. And I will take questions. I'm sure Dr. Forrester will take questions. And I just hope that some of this information kind of made you want to get up and do some more movement.
Thanks, Bonnie. Thank you both. We are ready to take some questions. I do have one question that came up already. This person said, may I ask if post-mastectomy pain syndrome, and she said neuropathy, is something they have found can go away with time, or are there other ways to help it besides neuropathic meds like gabapentin and Lyrica? I think, Dr. Forrester, that's for you.
The process of recovering from neuropathies can go a couple different ways. Some of the chemotherapies are much more likely to cause permanent changes. Some of them are changes that over time can come back. So some of that's going to be questions for your oncologist in terms of what type of chemotherapy you had. But there are treatments. For instance, there's something called desensitization, and it is as simple as putting your hands in a bin of rice to try to kind of reignite that feedback loop from your hands to your brain, to say that this is not painful, this is not toxic, and restart those neuron, that firing in a way that is kind of baby steps to introduce small amounts of stimulus. There are times where improving through exercise, as Bonnie had suggested, exercise truly is a magic pill. If we can get arms and legs exercising, that enhances the nutrition to the nervous system. It can clear out toxins in the system. And so there's a possibility that there would be less neuropathy. Nerve that has been truly damaged, there is what we call plasticity in the system. So there is some potential for regrowth, but it takes a while. We usually say about 1 millimeter a month. So if we're looking at the whole hand being numb or painful, depending upon where the insult is, we're looking at a regrowth process that can take quite a while. We're talking months to years. But again, clearing the toxins first with exercise. If it's related also to balance, numbness, tingling somewhere in the feet, working on balance, trying to get that control, that cognitive control, being aware of how you're moving, can sometimes help the brain kind of override some of that negative stimulus from hands and feet. So there's lots of things. Probably going to be more exercise, perhaps some soft tissue work, and it may be medically managed by your oncologist, but there's lots of possibilities. But for some folks, it is permanent, but perhaps manageable, where it's not always painful. Does that help?
Thank you. I don't know if she said she was going to be listening, so I don't know. Anybody else?
So sorry, I am listening. I can't really
Oh, you are.
respond.
Good.
Yes, I can't really respond specifically because I'm not alone right now, but Thank you so much for addressing that. I would just say in my particular case, it's not the hands and feet, it's the area where, if you could just
Yes.
say maybe
absolutely.
for me, I can't say.
Absolutely.
No.
Absolutely. So in the areas of surgery, perhaps.
Yes, yes,
in
that's what I mean.
those areas, there's lots of things that can contribute to the numbness. If the tissue has been stretched, and some tissue can be excised, it can be removed during the surgery and then stretched and brought back together. And in terms of a new seam, if you will, that creates a lot of tension in the skin. So working to make that skin soft and supple again, sometimes can increase the mobility and therefore the connection kind of between the head that's saying there used to be tissue here and it's gone and I don't recognize it, so working to soften that tissue, to soften the scars, can get fluid back into that area as well and perhaps increased sensation. The other thing is what I've had lots of success with folks when mobilizing the ribs. So really getting the ribs moving because that's the basement for that tissue. And there's nerve supply there too that maybe we can kind of tap into and help find some of that. It's not uncommon for the numbness to be there, but and last, but there may be able to be reduced, slight increase in sensation, certainly.
Thank you
Okay,
so
thank
much.
you.
I really appreciate it.
So Roberta asked, what is it? Does the cording ancillary web symptoms, do the cords ever go away? Or are
They
they
can.
always there?
Nope, they can. The cording, there was a time we weren't quite sure what it was, but more recent research suggests that that's part of your vascular return. So it's the veins wrapped inside tissue, wrapped inside skin and muscle and fascia that are burdened by the edema. And so resist back in the day, and I would even say maybe even 2 to 5 years ago, folks would say that they would try to pop it. Don't try to pop it. But we can soften the tissue around. We can help the lymph system move the fluid out from those overburdened areas, and the cording will subside. Yes, most often. I don't know that I've had patients that have had permanent cording. I haven't seen that. Can't say that it wouldn't happen, but cording, axillary web syndrome, something that can be well managed by a lymphedema therapist. Yes.
Okay, next question. Dr. Forrester, can you explain the cause of cancer-related fatigue that does not improve with rest? Do I assume I still have cancer, though it has been removed with a mastectomy? What is the relationship between cancer and this unique fatigue?
Sometimes before cancer is diagnosed, the patient can often talk about being fatigued because the body is really trying to fight that foreign agent. But cancer-related fatigue, as we know it, as it's defined, is from the process of treatment. So do you assume you still have cancer, though it's been removed with mastectomy? That's a conversation to have with your oncologist to be sure that they were able to fight it successfully. But the fatigue is separate from that. It's from the treatment. Chemotherapies try to find cells that are rapidly reproducing. So this one cell divides and makes another cell, and that divides and makes 2 more cells, and that divides and makes 4 more, and 18 or 60, dozens of cells. When that is uncontrolled, we call that a cancer. So the chemotherapy looks for cells that are rapidly reproducing, and it figures out how to kill them. The complication to that, the side effect often to chemotherapies, is that lots of our cells in our body are relatively rapidly reproducing. So like in our GI tract, because we don't want bacteria to linger there, in your mouth, anything that's kind of red and plump. Those cells your vascular system. Those cells have a certain life expectancy, sorry, and then they are meant to die and new cells come in. And the turnover for those cells is kind of high. So that's where the fatigue starts to come in, because the chemotherapy is looking, kind of many of them, unless it's targeted, if it's systemic, it's looking for any rapidly reproducing cell. And that's the cancer, and it can be some of our other systemic cells. And so your body is trying desperately to replace those healthy cells. And your lymphatic system is desperately trying to collect all that garbage, because we have these dead cells that are hanging out there in the periphery, and the lymphatic system wants to grab that and either break it down and recycle those parts and pieces or get rid of them. And so your whole system's kind of on overdrive, and with that chemotherapy, in response to the chemotherapy or in response to even the radiation. So it's more relative to the treatment that we undergo, that we have to push through. So it's the treatment that just wears down that system. So as Bonnie suggested, we kind of have to calculate how much is too much. What are the important things? Focus on the important things. Let somebody else put the dishes away, babe. Let somebody else do the laundry. Let's do the things that are important to you. So we focus how our energy is spent. And then we work on exercises to slowly but methodically increase that endurance and then that lean muscle strength. And so we can fight it. Yes. Does that make any sense? I hope that makes sense.
Okay, so Holly, you said it's really treatment-related fatigue. So that was, she just needs, to be told. Okay, thank you for the explanation. Okay, anybody else have any questions? Mary was asking, how do we reach you, Dr. Forrester?
I am available through NYU Langone at the Lake Success office in Long Island. So we can look up there, and I'm accepting new patients all the time. My job right now is really helping to develop an oncology program in that territory, in that area. So we're taking on, as I said, new patients, and we're looking at, if you know any oncology physical therapists out there, we're looking to take on some more because the need is great. The need is great, and we need to make sure, especially with women, that we are saying we are worthy of all that time and all that effort to feel good, to feel better, to receive care, and not just, well, everybody's tired.
Exactly. I have a question. Are there any new treatments for lymphedema other than the wrapping and, with the ACE bandages or whatever people have been using? New things coming down the pike?
New things coming down the pike. There are different styles of lymphedema therapy, I guess I would say. Traditionally, the thought process was, when the lymph nodes, say in the left armpit, have been disrupted, some have been removed, the traditional thought was to then avoid any transfer of fluid through that armpit. Truly, we should look at bringing that to other healthy lymph nodes, creating a whole new current. That is successful. If it doesn't happen to be successful for a particular patient, some of the newer research says that we can bring fluid to that disrupted area, almost like rehabbing an ankle. If you come to me with an ankle problem, I'm not likely to say, sorry, but you have to hop, use the other one. So if we're looking at an area where lymph nodes have been removed, not emptied, you have about 25 to 30 lymph nodes in each armpit out of the 600 to 700. So if they've removed 4, 5, 7, 10, there are still some lymph nodes in there. So we may be able to bring fluid to that area. Maybe it can't tolerate all of it, but maybe some. So that's a new philosophy in terms of how we treat. The second newer idea is that looking at the scar tissue, even in the trunk, even along the rib cage, whether there's been a reconstruction or no reconstruction, flat chest, those scars can be like a dam, a beaver dam, some sort of interruption in the flow of the lymphatic system. So getting those tissues softened, more mobile, can then allow that pathway to be reestablished. So we've got a couple different kind of new things coming down the pike. So there are some therapists that don't wrap or put compression bandages on, but you have to be the right candidate for that.
Okay, anybody else have any questions?
I just put one into the chat, Randy. I was wondering, is it okay to do blood pressure monitoring and blood draw from an arm where some lymph nodes are still remaining and there's never been any edema?
The consensus is that if you have had a single lymph node removed, you're on watch. If there's no swelling, you are what we would consider stage 0, which means you should take precautions. You should monitor. But the general consensus is that if the lymphatic system has been disrupted in any way, that we don't want to create a pressure gradient there. If we put a blood pressure cuff on, then we are in essence creating a tourniquet in that arm, even for a short period of time. The best expert is the person that actually was in there and saw those lymph nodes. So that would be a question for the doc. But even blood draws, we are changing the pressure. We're taking fluid off or out of that limb. So probably not the best idea. And usually they have to put that tourniquet on, that really tight rubber band around the top of the arm. So that's changing how the fluid flows. And I certainly wouldn't, I would really suggest against an IV where they're putting a lot of fluid into the body on that side, or if they have to do more of like, if you were going to donate blood on the other side, because again, that's a pressure gradient thing. That's how we kind of monkey with that system. The research is kind of pro and con, but I would ask your oncologist. Sometimes they'll even say after 5 years, you're okay, if you haven't had edema. But ask the oncologist. They were in that armpit. They saw what was going on in there. They're the ones that removed things. So they would best tell you what your precautions are. But as a general rule, it's easy enough usually to have them take the blood pressure or the blood draw in the non-affected or the arm with its lymph nodes intact.
Thank you.
Okay, one last question. Are there exercises or treatments regarding pain from radiation in the chest?
Are there for pain from radiation in the chest? Yes. Because that tissue has become fibrous and maybe stuck, we often do some soft tissue work first, but definitely getting the stability of the shoulders. We don't want the shoulders to roll forward because everything gets tight there. We want to make sure that the shoulder blade regions are nice and strong so they pull you up so you get this beautiful, upright posture again. So from that, and diaphragmatic breathing is your best friend because it keeps the ribs mobile. So nice deep breaths because the ribs were meant to be mobile. So if there's any limitation in the container, making the ribs move, bringing all that air in, slowly taking it back out, can get those ribs moving well again, and we can end up with some slight increase in movement as well for the chest.
Okay. Well, I'd like to thank you for your time, both Dr. Forrester and Bonnie. This was a really informative and interesting program this evening. For those of you who are interested in participating in any of our exercise classes or any of our other programs at the Nancy Marks Cancer Wellness Center, please feel free to reach out to us at 516-484-1545, extension 213, or you can call the direct line and just ask for me, Randy Height. And that's it for us tonight. I hope you all will have a wonderful Thanksgiving. Take a minute to find what you're grateful for. I'm always grateful that we have the opportunity to spend special time together. And I hope to see you all very, very soon. Keep an eye out for our next programs. Thank you again. Have a good
Thank you.
night,
It was just
everybody.
wonderful.
Thank you
Wonderful
so much.
program.
Thank you so much.
Thank you. Thank you all. Bye-bye.
Bye-bye.
Bye.